Hi, everyone. Welcome to today's discussion on polio and the polio vaccine. Joining us today are myself, and then we have Ella and Nick. Let's start with the basics. Ella, can you explain what polio is?
Absolutely. Polio is a viral disease caused by the polio virus. It primarily affects children under 5. The virus spreads through contaminated water and food or through direct contact with an infected person. Most people infected with polio virus don't show symptoms, but in some cases, the virus can invade the nervous system, leading to paralysis.
That sounds very serious. What exactly does the virus attack?
The poliovirus specifically targets motor neurons in the spinal cord and the brainstem. When these neurons are damaged, it can lead to muscle weakness or paralysis. In severe cases, the virus can affect breathing, muscles, leading to respiratory failure.
It's important to highlight that polio can leave survivors with long-term disabilities. This makes prevention through vaccination crucial.
Speaking of the vaccination, Ella, who developed the polio vaccine and how does it work?
The first effective polio vaccine was developed by Dr. Jonas Salk in the early 1950s. He created the inactivated polio vaccine, or IPV, which uses killed virus particles. Later, Albert Sabin developed the oral polio vaccine, or OPV, using weakened live virus. Both vaccines stimulate the immune system to produce antibodies against the polio virus, helping to prevent infection.
The introduction of these vaccines was revolutionary. Widespread immunization efforts dramatically reduced polio cases.
How did the United States manage to eradicate polio?
So the US achieved polio eradication by 1979 through a combination of public health initiatives, school mandated vaccines, and extensive community education raised awareness about the importance of immunization. The efforts were highly coordinated across local and national health departments.
That's right. The success was a result of comprehensive vaccination campaigns, especially during the 1950s and 60s. The quick response to outbreaks also helped contain the virus effectively.
Despite this success, polio still exists in other parts of the world. Ella, why do you think this is?
Polio remains endemic in a few countries, mainly due to factors like political instability, limited healthcare infrastructure, and vaccine hesitancy. In some regions, misinformation about vaccine contributes to low immunization rates.
Organizations like the Global Polio Eradication Initiative are working tirelessly to overcome these challenges. They focus on increasing vaccination coverage and improving health systems to reach vulnerable populations.
What can individuals or like the general population do to help the fight against the polio virus?
So awareness is key. Individuals can educate themselves and others about the importance of vaccination. Supporting local and global health initiatives also make a huge difference.
And staying informed about public health recommendations and participating in vaccination programs can help protect not only ourselves, but also our communities.
Thank you both, Ella and Nick, for the shedding light on this important issue. Polio was once a widespread threat, but through vaccinations and public health efforts, we've made significant progress. However, our work isn't done until polio is completely eradicated globally.
Absolutely. I mean, together we can ensure a future free of polio.
And remember, vaccination is one of the most effective tools we have to prevent infectious diseases.
Thank you, everyone, for joining us today on our discussion of polio, and make sure to stay informed and engaged in the health issues that affect us all.